It is my unmitigated pleasure to introduce Dr. Paul Kershaw, who is an associate professor at the university here at UBC and a director of the UBC Masters of Public Health program. But he's also a public speaker, regular media contributor, and founder of Generation Squeeze, and a recipient of many awards for research policy and knowledge to action initiatives. Moreover, and if you don't know that yet yourself, you will find out listening to Paul is always a treat. So it is my pleasure to pass the screen on over to Paul. Thank you.
Thank you, Magdalena. That's a very kind introduction. And let me just make sure I bring my slides up so that people can see them. One more click. Could I get a thumbs up from any colleague that you can actually see my slides?
Yes, we can.
Splendid. Thanks, team. Well, it is a great pleasure to join everyone this morning. And Diana mentioned earlier that she was a Clyde groupie, and I'm not sure if I ever thought of myself that way, but I think that's a great moniker to take on. And so I'm proud to be in that category today too, as we honor the incredible legacy that he has left for those of us at the Human Early Learning Partnership, for those of us in the province of BC, across this country, and indeed around the world. My talk today is going to focus on the factors that help explain why British Columbia has a higher rate of early vulnerability than do other provinces. And I am going to share work that was done in concert with my wonderful colleague, Dr. Barry Forer, who's been a tireless research colleague of all of us at the Human Early Learning Partnership now for decades. And the good parts of what I'm going to show to you today are the responsibility of Barry. Anything you don't like, I will entirely own responsibility for. I come to you from the traditional unceded territory of the Katzie people, which is at the confluence of the Pitt and Fraser Rivers in British Columbia, maps that reflect the harmful legacy of colonization, now call the area Pitt Meadows and Maple Ridge. This slide is a typical kind of slide that we have often showed to people at Help Expos in past years, where we focus on BC specifically and often try and look at how the vulnerability rates that we see in communities and in neighborhoods vary from one place to another. These are very important maps that underscore the need for us to reduce inequality in the province, to address just a great degree of clear unfairness in terms of the starting points that are offered to different people depending on where they live in the community. And indeed, we can gain important information about what's shaping early child development by understanding how neighborhoods and regions within BC differ. However, I'm also of the mind that we can never fully understand the full range of factors we need to gain hold of and to change in order to improve early vulnerability if we don't simultaneously look at what's going on in British Columbia and across the country. In other words, if we don't take a provincial and a federal perspective. And I often have really liked this map of BC, which effectively is intended to show that just generally, no matter where you look in our province, we have surplus vulnerability. And so we have to think at a provincial level, how are we going to double down on reducing that early vulnerability rate in our province by comparison with other places in this country. For many years, it was difficult to do BC comparisons to other provinces when thinking about the early development instrument because we just didn't have enough data yet. We hadn't had enough time to collect data. However, I must say, as a result of the tireless work of people like Magdalena and Martine and Clyde and others, we now have actually a very exciting pan-Canadian data set that includes 30 different provincial EDI vulnerability rates since the year 2005, and at least one provincial vulnerability rate for every province. So that opens up new exciting opportunities, and this database for pan-Canadian comparisons is only going to grow in the future. And so today, I'd like us to think about what we can learn about BC by comparing it to other provinces. I'm going to start with a slide that Magdalena also used earlier today, which is just to walk you through different provincial vulnerability rates. There's Alberta and Quebec and Manitoba. You've got Newfoundland down here with a markedly lower vulnerability rate. Nova Scotia, more in the middle of the pack again. Ontario, I'm going to really focus on distinguishing between BC and Ontario in a moment. You've got PEI, again, one of the places with low vulnerability. Saskatchewan, only one data point. I'm sure I'd like to get more of those. And then you see, regrettably, British Columbia with pretty consistently the highest rates of early vulnerability in the country. And if anything, it has been growing slightly over time. Not at all what any of us in this Zoom room want. I'm now going to get rid of all of the provinces but BC and Ontario, and I want people just to remark actually the large gap that exists between these two provinces. That is an 8 percentage point gap between BC at around 34% of children being vulnerable when they start kindergarten, by comparison with Ontario, where they have 26%. If we want to ask what is and what could be, we should be asking ourselves in this province, and right now we should be making it the front page news of most newspapers, and then a really good headline on many newscasts, whether it's podcasts or CBC or CTV or Global that you watch, because if BC had Ontario's rate of early vulnerability, we'd have approximately 3,200 fewer children start in our school system vulnerable, and then having to address those vulnerabilities as they work their way throughout the school system year after year. In other words, instead of 6 vulnerable children being in every kindergarten class, if we had Ontario's rate, the rate they have right now, we would have 4.5 children. I know we can't have half children relate, but my point is you'd have a 25% reduction tomorrow. So given that we don't have Ontario's rate of vulnerability, and it's not that Ontario is some paragon of like excellence for early child development, there's lots of surplus vulnerability there still, why do we in BC have higher rates of vulnerability than other provinces? And our data is going to disproportionately benefit from comparisons between Ontario and Manitoba, the other jurisdictions that have been collecting the EDI most routinely. The answer to why BC has higher rates of vulnerability, I would argue, reflects this Bronfenbrenner model that many people who've attended earlier EDI Help Expos will have seen in one version or another. There are a range of influences that influence early child development, from what's happening in their home, what's happening in their neighborhood, what's happening in their community, and then all the way up to the broader area, what's happening in their economy, in the province, and the country, and the planet, etc. I tend to focus a lot on those outer circle issues and want to offer that why does BC have the highest rates of early vulnerability in the country? Well, in no small part because our economy has made hard work pay off less for the generations raising young children in BC by comparison with other provinces in this country. And that fact is this challenge of our economy allowing hard work to pay off has implications for both our politics going forward, and it also reflects realities of our politics right now. Now, many people who focus on British Columbia and our economy will routinely say, hey, in recent years, we've had pretty darn good rates of economic growth. Look at that thick red line in the slide that I'm showing you right now. That's the one representing BC. All the other lines going up and down are the other provinces. And you can see that our thick red line is generally higher than most provinces, and certainly was pre-pandemic. And so that often leads our politicians and other decision makers to think that, oh, okay, we're doing relatively well with our economy. And in terms of measuring our gross domestic product and how that's changing, you must give full support for that data point. It is true. Our GDP is better than lots of other places a lot of the time lately. But this is a slide that actually looks at the 30 provincial data points that we have collected across Canada since the year 2005. And as you move from left to right, you get on the right-hand side, the places and the times when provinces have been having better rates of economic growth. If you move from bottom up, you go from low rates of early vulnerability to higher rates of early vulnerability. And so what this slide is showing, this scatter plot, it's showing that the association between better economic growth is actually relatively weak with the EDI vulnerability rate. And if anything, as economic growth goes up on an annual basis, we're seeing associations that suggest vulnerability also goes up. So in other words, it's giving us a signal that if we want to understand if our economy is healthy for the generation raising young kids, we have to look beyond annual gross domestic product growth. This is another slide. I think it's even more powerful. This is a slide that looks at the unemployment rate for people in their prime childbearing and rearing years. Again, as you move toward the right-hand side of the slide, you'll see that we get more and more unemployment. Generally speaking, we think unemployment's not a good thing. And the strange issue that we see in this association is that as we get more unemployment in our 30 EDI provincial data points, we're seeing that actually vulnerability seems to associate in a downward way. Doesn't really make a lot of theoretical sense. No one's going to want to create an economy where we have more unemployment. We definitely are seeing the harm that comes from unemployment amid a pandemic. And yet it's signaling to us, hey, this rate of unemployment, again, is a bit too blunt for trying to understand what's going on for the generation raising young kids. Now, I just want to be clear, this is not to say that better child development requires more unemployment. Instead, we're wanting to put out there to you today that these sorts of associations invite us to recognize that some economic strategies may be better than others for the generations raising children. And in addition to that, unemployment levels are too blunt a measure to rely on for judging that our economy is serving younger generations well. And so the EDI research is pushing our decision makers at the local level, at the provincial level, and at the federal level to start thinking about what other economic indicators should we be considering when we're trying to explain what may be impeding child development from being optimized in our province. I have now long said at these kinds of meetings and in other places that the growing gap between home prices and earnings is a big issue in our country, and especially in our province, and especially where we're meeting today, or I'm coming from in Metro Vancouver today. I invite people to look at the two lines on this line. The blue one showing what home prices have done over the last 4 decades. The orange line is showing what's happened to earnings over the same time period, especially for those in their prime childbearing and rearing years, and it controls for full time. This is the Canadian average, and you can see a more than doubling of average home prices across the country. This is the British Columbia version of that graph, which effectively shows a tripling of average home prices after adjusting for inflation across the province. And if I were in person with you, I like showing this slide because I'd have hear everybody gasp. This is what it looks like in Metro Vancouver, where there has been a quadrupling of average home prices over the last several decades, while earnings have remained flat and actually been going down for young people after adjusting for inflation. Back when I was born in this region and in this province, it took the typical young adult around 5 years of full-time work to save a 20% down payment on an average priced home. If you flash forward to today, across the country, it's taking more like 13 years. In British Columbia, getting over 20 years. And in Metro Vancouver, it's getting pretty darn close to 30 years. That is a key example of how hard work does not pay off like it used to. When we start looking at these scatter plots for the association between housing values, average housing values at a given time in a province relative to the vulnerability rate measured in that year, you'll see as home prices get higher, you move to the right-hand side of this graph. And at the same time, you'll see that the association is that vulnerability rates also rise. This is as we would predict. Home prices leaving earnings behind is not good for hard work paying off. But when we started looking at this scatter plot, we did have to draw attention to the fact that Manitoba and Saskatchewan also have had vulnerability rates that rivaled BC, especially when we first started our data collection. And yet they're not the kinds of provinces that have been having particularly high home values. And so this pushed research with Barry and me and others to start thinking about what other factors might be accounting for some of the big differences in vulnerability rates between provinces, even if they're not sharing the same economic circumstances. One of the things this led us to hypothesize is that Manitoba and Saskatchewan differ from other provinces in terms of the proportion of the population that has been directly subject to the harmful, pernicious legacy of colonization. Think about how economies of Indigenous communities have been disrupted by reserve systems. Think about how the transmission of language and culture has been disrupted by residential school systems. Well, Manitoba and Saskatchewan have shares of their population that are twice as large, directly feeling that legacy of colonization by comparison with most other provinces. And so one would hypothesize and predict that that would then give rise to higher rates of early vulnerability at the provincial level. In keeping with these kinds of observations, Barry and I dug into looking at what other factors might we need to look at. So we considered issues like low income and poverty, inequality, female labor force participation, the child care service system, costs and availability, although I have an asterisk here because we haven't quite nailed the data collection for that to really dig into it in the way that we'd ultimately like to, and that's ongoing work. You know, how does the population look in terms of the proportion of kids, and especially compared to the proportion of workers who can help support those kids? The size and density of the population, you know, PEI and Newfoundland, those are smaller provinces, all things considered. Does that make it easier to some degree to reduce early vulnerability rates at the provincial level? And then last but not least, the relative affluence of the economy, measured in terms of the size of our gross domestic product divided by every person in the province. When we look at these kinds of factors, our goal was to identify, and this is for some of the academic colleagues in the room right now, I'm going to get a bit technical for a moment. Our goal was to identify a best, in scare quotes, subset of provincial socioeconomic measures so that together they provide an optimally fitting model of the variation in EDI vulnerability between provinces while maintaining a theoretically coherent and also reproducible pan-Canadian model of interprovincial differences and also trends over time within provinces. That's what we're aiming to produce here, and that we'll continue to try and refine it over time. Our methods are absolutely exploratory at this stage, and they're guided in particular by a well-renowned academic named Josta Esping-Andersen, who has worked with small sample size and done regressions with small sample sizes as part of his internationally renowned comparative welfare state research. Following Van Lenker and colleagues, we have conducted a series of best subset linear and multiple regressions using both the adjusted R-square and the AIC as the basis for selecting the best subset. And of some interest, it's worth knowing that we're looking at socioeconomic data, both in the year in which we measured children by the EDI, so when they're age 5 or 6, and also in the year around when they were born, about 5 years before that. Okay, that was my technical slide. Interestingly, when we looked at these, the variety of variables that could be shaping the EDI vulnerability rates across provinces, we see in purple the 4 socioeconomic characteristics of provinces that emerged to be the most important in our modeling when looking at vulnerability on one or more scale and when looking at individual scales on the EDI. So housing emerged, colonization emerged, low income and or poverty emerged, and then the affluence of the economy, generally speaking. Our models accounted for about 56 to 63% of the variation in provincial vulnerability rates on one or more EDI scales. And interestingly, SES, socioeconomic variables at the year of birth, not the year we measured kids in kindergarten, but the year they were born, those models tend to be a wee bit stronger than the models that rely on SES characteristics in the year that we took the EDI measurement. In other words, that's signaling that to some degree, it may be the case that the socioeconomic characteristics into which children are born has more opportunity to shape the developmental opportunities of those children, and then has a slightly bigger impact when we're picking up at what were the experiences that made a difference for children as they start our school system. I'm going to say this multiple times. I just want to underscore it right now. These 4 characteristics of provinces give rise to important policy relevant findings. They're going to invite provincial and federal governments to recognize if we want to reduce early vulnerability, we need to be in the game of thinking about improving our housing affordability plans, our truth and reconciliation plans, our poverty reduction plans, and rethinking our economic growth strategies more generally. In order to make that case, let me dig into the data still further. And I do want to acknowledge that now I have some slides that have got tons and tons of numbers, which are not the easiest to digest. And I'm going to use some color coding to walk you through it. But to make a long story short, you'll see 4 columns: housing, directly subject to the legacy of colonization, low income, and GDP per capita, and a bunch of numbers under there. Each of these numbers is actually trying to to rate where that province at that particular time period compared to other provinces in terms of their relative strength or weakness on these characteristics of their economy. We've normalized the scores around 100, 100 being the average. And when you see scores that are above or below 100 by more than 15 points, a standard deviation in our units here, that is like a magnitude of order difference. And so I'm wanting generally for people, if you have the gusto right now to dig into all these numbers, look for numbers that are like above 120 or below 80. These are starting to be the big differences between provinces in our 30-point data set. And you'll see in pink here, I've highlighted that there is no number higher on this chart than housing for British Columbia in our most contemporary year. You will not see 132 appear anywhere else on this slide. The only other data point that rivals the high housing prices of being so different in BC compared to everywhere else, is when you look at GDP per capita for Alberta. In this case, actually, here it's a low number. So high numbers relate to higher rates of vulnerability, low numbers relate to lower rates of vulnerability. Interestingly, Alberta has remarkably good GDP per capita. The GDP per capita in Alberta in 2016 was $80,000 per person there. By comparison, in BC, it was only $53,000. That is a big difference when signaling your overall affluence of your economy. But it is worth pointing out that it's not clear from our data that actually GDP per capita should be weighted as heavily as the housing costs in terms of explaining overall vulnerability rates, because Alberta still has a relatively high vulnerability rate at 29%. It's certainly, not like the PEIs and Newfoundlands of the world. And it's also worth noting that PEI has one of the one of the worst GDP per capita values, and yet it has the nearly lowest vulnerability rate of any province at any time that we've measured.
Oh, we're just going to have a couple more minutes so we can save time for questions.
Yep, I am on track.
Thank you.
Probably 4 minutes if you'll tolerate me. Why is Ontario different than British Columbia? Well, you'll see that Ontario, it has relatively high home values. This is a magnitude lower still than British Columbia's. And also it has a half a magnitude lower, a part of its proportion demographically subject to the direct legacy of colonization. There are many other factors that likely explain why Ontario is lower than BC, and I suspect we need to dig further into the fact that it has 2 years of full-time kindergarten, whereas BC has only 1 year. In other words, the nature of the early childhood education system in the provinces is varying in important ways. Newfoundland is much better than BC, you'll see, because it consistently has lower values in terms of home prices and has better poverty rates, and it also has better GDP per capita. Can we learn anything about why BC has not improved its EDI vulnerability rate over time? And the answer to that is yes, there are some interesting signals that Barry and I have been producing. Back in 2006, the highest number in terms of what was harming BC's vulnerability rate wasn't housing when we started. It was actually the low income rate. Back then, when we started, the low income rate was around 15%, and housing, if you can imagine, in British Columbia on average, was around 310,000. If you flash forward to today, though, low income dropped to around 9 to 11%, whereas average home prices have gone up 16 to 619,000 or almost 700,000. So the drop in low income rate was not sufficient to some degree counter the increasing gap between home prices and earnings, which was more generally making hard work not pay off for British Columbians in their prime childbearing years. To be clear, while some provinces illuminate socioeconomic signals more than others, these results should be interpreted as showing that all 4 policy relevant findings apply to all provinces. So all provinces have reason to address their housing affordability issues and make sure they don't get out of control like in BC, and to advance truth and reconciliation and improve our poverty reduction efforts, and to change how we're growing our economies. So let me just wind up thinking about what does that mean for British Columbia? If a pandemic-induced recession does not deflate home prices, we can no longer ignore the probability that our housing system is actually structured, even if unintentionally, to grow housing values out of reach for local earnings. And so we need our province to say that, yes, our 30-point housing plan has been better than what we had in the past, but it's still not yet up to the task, nor is the national housing strategy. And similarly, we need in our province and across the country more action to promote truth and reconciliation, which invites all of us to ask ourselves in this Zoom room, what responsibility do we have to advance reconciliation and to reduce the persistent harmful legacy of colonization? And as we do so, what more does that mean we need to ask our legislators to do? We're going to need better poverty reduction plans. And one thing I'm hopeful about is that the pandemic response has awoken our heads and our hearts to what adequate levels of income support look like, as well as the need for fair wages for work of essential value, that childcare work, that work in extended care facilities, on our buses, in our supermarkets. And we do need better economic development strategies. This graph shows that much of Canada's economy has been growing over the recent years because we've been growing real estate. Real estate's been growing our major cost of living, but not producing many jobs. About 13% of our GDP across Canada is rental and real estate. Fewer than 2% of Canadians find employment in that sector. In BC, it is even worse. And this is not a sustainable approach to growing our economies. And if we are growing our economy at the expense of our kids, what's the point? It's time now for anyone who wants to build a strong BC economy to recognize that our EDI is actually a key indicator. It's a key indicator of the adequacy of our housing plan, truth and reconciliation plan, poverty reduction plan, economic plan. And while I haven't had a chance to feature it today, it's an important indicator of our childcare plan and our healthcare plan, and I imagine soon also our climate control plan. We need our ministers around cabinet to plan accordingly. We need them to budget accordingly. We need citizens to demand accordingly. And we need to incentivize our politics accordingly. Because politics responds to those who organize and show up. It's one of the key reasons why we've worked hard over recent years to build xWməthkwie as a novel knowledge mobilization machine to help people signal that they're showing up in support of the science, in showing up in support of the evidence. So I hope that many will join us at xWməthkwie.ca to help amplify our voices in order to amplify the power of the science. Because we need to give politicians the political cover required to make courageous changes to the systems that have long shaped our society. Because that's what the EDI is showing us. It's reminding us year after year that we need systems change to reduce early child vulnerability. And if we do so, that is how we can make this province and our country work for all generations. Thank you.
Thank you, Paul. Many thanks. I'm going to turn it over to Sally because I'm sure there are some questions.
Yes, thank you, Paul. Illuminating and inspiring as always. And thank you about asking us to reflect on our own responsibilities today. I think that everyone is keeping that very close to their hearts today as we go through this session together. I have a question from someone you'll know well, Pippa, is wondering, she wanted to check in to confirm whether you're using data adjusted to remove children with special needs from the data set between BC and Ontario.
Yes, so the data are made analogous between the two provinces in a variety of ways, including that one, Pippa, but also we have controlled for age and gender. This is one of the first times that I've really seen us do that for pan-Canadian research. And it was important, actually, in terms of changing the relative ranking of Ontario compared to Quebec. Oftentimes we've seen Quebec as having the lowest rates of vulnerability amongst the big provinces, but Quebec also has, it does its EDI in a way where the children tend to be 3 months or so older than they are in British Columbia. And when you're under 6, 3 months is a big chunk of your life. And so lots of opportunity for more development. And when you adjust for that age factor, then Quebec actually no longer has the lowest rates of early vulnerability in the province by comparison to BC and Ontario or Manitoba. And I think that control that you were talking about, Pippa, is bang on and led me to have new insights about the EDI data. Great question.
Thanks, Paul. We have a message from Brenna, who she has now said, Paul has answered my question, but I'm just going to say it out loud in case you have anything else you want to unpack about it. Brenna had previously asked, could the increase in unemployment be associated with the lack of affordable childcare that currently exists, forcing many women out of the workforce?
Yeah, great question. Unemployment is a technical measure from StatsCan. And so when childcare is not available and drives people, in particular women, because of the gender division of labor and the ongoing legacy of patriarchy, out of the labor market, if they're not signaling as a result that they're looking for work, then they would not be counted as unemployed. They'd just be out of the labor force. So unemployment is picking up people who are signaling they want to be in the labor market and can't find work. Now that could be people who are unable to find work in part because they can't get it to jive with their childcare. So there's some messiness there to tease out. The data that we're working with right now are a wee bit blunt on that front. But the biggest point really is that at the provincial government level and the federal government level, every year, for instance, I go into our budget lockups to see how governments are going to spend our money, because that, in my view, really reflects our priorities. And every time I do that, a finance minister will say, look, our unemployment's looking pretty good and our gross domestic product looks pretty good. And so they take that as like, we must be doing well. And now I'm wanting people in this room to help us take the message to our decision makers, including in finance, including in the Premier's office, that look, if you really want to understand if our economy is doing well, use the EDI as an outcome measure, and it will show we need to look beyond unemployment. We need to look beyond GDP to consider some other things. And we've highlighted today housing, poverty or the low income status, and the ongoing harmful legacy of colonization.